Did you know that many signs of cancer are discreet and can go unnoticed? This can reduce your chances of successful treatment. Studies show that 1 in 3 people will be diagnosed with cancer, and many cases are only detected in advanced stages. As a health expert, I see that simple symptoms, such as joint pain or spots on the skin, can be serious signs. In this video, I'll show you 9 signs of cancer that you can't ignore and give you tips on how to act. Stay until the end, as the last sign is often ignored. Before we start, subscribe and leave your like. Let's get down to business. 1. Persistent bone pain. Persistent bone pain, especially when it gets worse at night, is one of the most common but often overlooked early warning signs of cancer. Many people dismiss bone pain as something minor, perhaps just a muscle strain, normal aging, or the result of a recent workout. However, when the pain doesn't improve or intensifies over time, especially when you're at rest, it could be an indication of a more serious illness, such as bone cancer. Osteosarcoma, a type of bone cancer, usually presents as a dull, aching pain that can get worse at night, interfering with sleep and daily activities. The pain may not respond to over-the-counter painkillers, which is another warning sign. As the tumor grows, the pain can become more intense and may be accompanied by visible swelling or tenderness in the affected area. This swelling is usually located at the site of the pain, such as the arms, legs, or spine, and can limit movement or cause difficulty when trying to put weight on the affected bone. It's important to note that bone pain caused by cancer is often different from typical muscle pain, which usually improves with rest or stretching. Ignoring unexplained and persistent bone pain can lead to delays in diagnosis, which can decrease the chances of successful treatment. If you are experiencing pain that lasts more than a few days or seems to worsen over time, especially if it is not relieved by standard pain relief methods, don't hesitate to consult a doctor. Early detection of bone cancer, like that of any other cancer, is crucial for better treatment results, so be proactive in addressing any symptoms you are experiencing. Remember that if the pain persists or intensifies, it's best to see a doctor as soon as possible. 2. Pain and eye changes. If you've noticed sudden pain in your eyes, changes in vision, or flashes of light, you may be experiencing symptoms of ocular melanoma, a rare but serious disease. Like skin melanoma, ocular melanoma can develop in the eye and affect your vision. People with lighter skin tones, especially those with blue eyes, are at greater risk of contracting this disease. Ocular melanoma can cause symptoms such as blurred vision, spots or flashes of light, and even a dark spot in the iris or peripheral vision. In some cases, the changes can be so subtle that they are difficult to detect on your own, which makes it important to schedule regular eye exams with an ophthalmologist, especially if you are noticing any changes in your vision. Early detection is key, as ocular melanoma can spread to other parts of the body, and the earlier it is detected, the better the prognosis. Don't wait until symptoms worsen or your vision is significantly affected. Getting an eye exam at the first sign of discomfort can help detect the problem before it becomes more serious. Before we continue with our list, don't forget to subscribe to the channel and leave a like. This helps us bring you more content like this. Come on, keep watching. 3. Unexplained rashes and bruises. A rash is usually nothing to worry about, but when it becomes persistent and is accompanied by unexplained bruising, it could be a sign of leukemia. Leukemia is a cancer that affects the blood and bone marrow, and one of its first symptoms can be changes in the skin, such as unusual rashes or bruises. These rashes are usually red or purple and may not go away even with treatment. In addition to the rash, people with leukemia may experience symptoms such as fatigue, weakness, unexplained fever, or spontaneous bleeding. Bruising can occur easily, even without any noticeable trauma, and the skin can appear more fragile. If you notice a rash that doesn't improve with typical treatments, or if you start bruising for no clear reason, it is essential to seek medical advice. A thorough evaluation, including blood tests and possibly a biopsy, can help determine whether it is something more serious, such as leukemia. Early diagnosis and treatment can make a big difference to the outcome of the disease, so don't delay in seeing a doctor if these symptoms are persistent. 4. Dark lines on the nails. If you've noticed dark lines under your nails, this could be more than just a harmless bruise. It could be a sign of subungual melanoma, a rare form of skin cancer that develops under the nail. These dark lines, which can appear black or brown, can often be mistaken for a bruise, but they don't disappear over time. Unlike hematomas, which disappear gradually, these lines can persist or even worsen, especially if they are larger than 3 millimeters or have irregular edges. Subungual melanoma can also cause the nail to become deformed or the surrounding skin to darken. If you notice these changes in your nails, it's important not to ignore them. The earlier melanoma is detected, the more treatable it will be. If you notice any unusual marks, such as dark streaks under your nails, it's important to visit your doctor or dermatologist for a full assessment. A biopsy or imaging tests may be necessary to determine whether it is melanoma or another disease. Remember that detecting skin cancer early is crucial for effective treatment, and catching it in the early stages can make a significant difference to your recovery. 5. Night sweats. Night sweats are common and can occur for various reasons: stress, hormonal changes, or even a hot environment. However, if you are experiencing night sweats without any obvious cause and they are accompanied by other worrying symptoms, this could be a warning sign of lymphoma, a cancer of the lymphatic system. Lymphoma can cause unexplained fever, persistent night sweats, and sudden weight loss. Night sweats are usually drenching, leaving your sheets and clothes soaked, and can occur regardless of the temperature in the room. These symptoms, if they persist for weeks, or if you start to notice other signs such as swollen lymph nodes or fatigue, should not be ignored. Although night sweats can be associated with other less serious illnesses, if they occur in conjunction with other unusual symptoms, such as unexplained fever or weight loss, it is essential to seek medical advice. Early diagnosis of lymphoma is essential, as it increases the chances of successful treatment. Don't assume that these symptoms are just related to the menopause or stress. Consult your doctor if they are persistent. 6. Persistent heartburn or difficulty swallowing. Although heartburn is something many of us deal with from time to time, when it becomes persistent and doesn't respond to over-the-counter antacids, it could be a sign of something more serious, such as esophageal cancer. If you have frequent heartburn, especially if it's accompanied by difficulty swallowing or the feeling that food is stuck in your throat, it's time to pay more attention. These symptoms may indicate that something is blocking the esophagus, such as a tumor. Esophageal cancer usually develops without noticeable symptoms at first, but as it grows, it can cause severe discomfort when swallowing, and you may start to lose weight unexpectedly. If you're dealing with chronic heartburn that doesn't go away with medication, or if you have any difficulty swallowing, it's essential to see your doctor immediately. He or she may recommend an endoscopy or imaging test to rule out cancer, or to detect it early if this is the cause. Early detection of esophageal cancer can significantly improve treatment outcomes, so don't ignore these signs. 7. Jaundice. Jaundice is a condition that causes a noticeable yellowing of the skin and the whites of the eyes, and usually signals a serious problem with the liver or pancreas. This occurs when the liver is unable to properly process bilirubin, a yellow pigment produced by the breakdown of red blood cells. Normally, the liver filters out excess bilirubin, which is then eliminated from the body. However, when the liver or bile ducts are compromised, as in the case of cancer, this process is interrupted, leading to a buildup of bilirubin in the bloodstream, which results in the yellowish discoloration. Jaundice is commonly associated with liver cancer, pancreatic cancer, and bile duct cancer. However, it can also be a sign of liver disease or obstruction of the bile ducts. In addition to the characteristic yellowing of the skin and eyes, jaundice is usually accompanied by other worrying symptoms. These include pain in the upper right side of the abdomen, where the liver is located, dark urine, which can appear brown, pale stools, and a general feeling of malaise. Unexplained weight loss and nausea can also occur in more advanced cases. It is essential not to ignore jaundice, as it is a clear indicator that there is something wrong with the liver or pancreas. If you notice any of these symptoms, you should seek immediate medical attention. A timely diagnosis can make a significant difference, especially when cancer is the underlying cause. Diagnosis usually involves blood tests to assess liver function and imaging tests, such as ultrasound or CT scans, to visualize the liver, pancreas, and bile ducts. Early detection of cancer can significantly improve treatment outcomes, so don't delay in seeking a checkup if you notice any signs of jaundice. 8. Unexplained weight loss. Unexplained weight loss is one of the most common but often overlooked symptoms of various forms of cancer, especially in the early stages. This sign can indicate that the body is facing a serious metabolic disorder. Cancers of the pancreas, lung, esophagus, and stomach are often associated with unintentional weight loss. When you start to lose weight without changing your diet or exercise routine, this can be a sign that the cancer is using up your energy reserves. In addition, many forms of cancer release substances into the body that affect metabolism, resulting in rapid and unexplained weight loss. This symptom is usually accompanied by other signs, such as extreme fatigue, unexplained pain, or changes in appetite, especially loss of appetite. Unexplained weight loss should always be investigated by a doctor, as it could be an indication that the cancer is causing a breakdown in the digestive system or affecting the absorption of nutrients. In some cases, weight loss can occur because the body is trying to fight the inflammation caused by the cancer. Therefore, if you notice significant weight loss over a short period of time, it is essential to consult a doctor to rule out serious conditions and carry out tests, such as blood analysis or imaging scans, to understand the underlying cause. 9. Difficulty breathing or chronic cough. Difficulty breathing and a persistent cough are symptoms that usually indicate respiratory problems. But when these signs are unexplained and do not respond to conventional treatments, such as decongestants or antibiotics, they can be signs of lung cancer. Lung cancer can cause these symptoms in different ways. An obstruction in the airways or a tumor in the lungs can make it difficult to breathe normally. In addition, a chronic cough, which can be dry or productive with phlegm, is a common feature of lung cancer, especially if the cough worsens over time and does not improve with traditional treatments for colds or respiratory infections. This type of cough is usually accompanied by chest pain, difficulty breathing, and, in some cases, blood in the sputum. Shortness of breath can also be a symptom that the cancer is affecting lung function, compromising the exchange of oxygen in the lungs. In addition, difficulty breathing can be an indication of metastasis, i.e., when the cancer spreads to other parts of the body, affecting vital organs. If these symptoms persist for weeks or worsen over time, it is essential to consult a doctor. Imaging tests, such as X-rays or CT scans, are essential to detect possible abnormalities in the lungs and help diagnose diseases such as lung cancer or other serious respiratory illnesses. The earlier the diagnosis is made, the more effective the treatment will be, increasing the chances of recovery. First, look out for the signs. It could be persistent pain, unexplained weight loss, a spot on your skin, a cough that won't go away, bleeding out of season, or even changes in your bowels. Don't let anything go unnoticed. Write down everything you feel and notice. Your body is talking, and you need to listen to it. The next step is to see a doctor. It doesn't matter if the symptom seems small or insignificant. The most important thing is to seek professional advice. The earlier the cancer is identified, the greater the chances of successful treatment. Also, get checked regularly. If you have a family history of cancer, don't wait for signs to appear before going for a checkup. Prevention is always the best course of action. When your doctor orders specific tests, such as a mammogram, colonoscopy, or even a biopsy, don't procrastinate. Do them without delay. These tests can save lives and detect problems before it's too late. Avoid self-medication. Although the temptation is great, don't take medication on your own, especially for symptoms that don't go away. Only a doctor can give you the right advice. Also, remember to adopt healthy habits. Regular exercise, a balanced diet, avoiding too much alcohol, and of course, never smoking, are all factors that can reduce the risk of cancer and improve your overall health. Finally, stay informed, but always look for reliable sources, and most importantly, talk to your doctor. Don't replace professional advice with information found on the internet. Early detection is a determining factor. If you notice any unusual signs, don't hesitate. Seek medical help as soon as possible. Your health cannot wait. Cancer is a disease that usually doesn't show clear signs until it's too late. But that doesn't mean you have to wait for a diagnosis before taking action. By keeping an eye out for unusual symptoms, be it persistent pain, skin changes, or unexplained sweating, you can detect cancer early and increase your chances of successful treatment. Remember, don't ignore what your body is trying to tell you. If you notice any of the signs we've talked about today, see your doctor immediately. Detecting cancer in its early stages can save lives. If you found this information useful, don't forget to subscribe to our channel for more health tips that could save your life.